Deep Brain Stimulation for Parkinson's Disease by Benjamin Setcher and Gina Lupino. What is DBS? DBS is short for Deep Brain Stimulation. Most simply, DBS involves electrodes placed deep inside the brain, connected to a battery which is surgically placed in the chest through electrical cords tunneled through the neck. The image shows the 6-inch electrodes that are embedded in the right and left sides of my brain.
Neurological diseases pose a daunting challenge for many patients. DBS offers a way to externally drive neuronal activity by delivering electrical impulses directly to brain tissue. This involves an invasive procedure, but for some diseases, DBS offers the most promising symptomatic solution. DBS is currently used to reduce symptoms in diseases like essential tremor, dystonia, and Tourette's syndrome. DBS is most famously used, though, to treat Parkinson's disease. This video will primarily cover DBS in Parkinson's disease. Hi, we are Gina Lupino and Ben Setcher. We are patient advocates who use DBS to help control symptoms of Parkinson's disease.
Parkinson's disease is a motor disorder caused initially by loss of dopaminergic neurons in the substantia nigra. Patients like myself experience tremor, bradykinesia, and dystonia. However, almost every patient gets their own unique badge of symptoms that tend to get progressively worse as the disease progresses. There are various dopaminergic medications to help treat the symptoms, but they all have side effects that can be incredibly disabling as the disease progresses. Oral therapies have diminishing return. Advanced therapies such as DBS can be utilized as an adjunct to conventional therapy. The electrodes provide stimulus to help reduce unwanted movements that are caused by degenerating dopaminergic neurons. Without those interfering movements, I can move the way I want to. Common side effects of DBS include speech, gait, and balance issues. Some patients also experience episodes of mania. In addition, certain vigorous activities that require a lot of upper, lower, right, left limb control, such as swimming, tend to become more difficult. I got DBS because medication was working less and less to control my Parkinson's disease symptoms. Before my surgery, I found myself confined to the basement of my parents' home. The relentless oscillations between my medications on-off cycles and the effects of my Parkinson's disease had dwindled my functional window to a mere 2 hours per day. Within this narrow span, I could accomplish essential tasks for the day. Whether it involved productive work, engaging with my niece and nephew, or tending to basic routines like eating or brushing my teeth. Life itself seemed to be compressed into these tiny fleeting pockets, leaving me bereft of the ability to embrace the life I aspired to lead.
Let's start with the halo being screwed into our heads at 5 a.m. Rise and shine. My face and scalp were shot up with lidocaine. My entire face and scalp became numb. They manually screwed a metal cage into my head. I felt kind of drunk, woozy, super teary, and emotional. As the nurse wheeled me to the OR, I said goodbye to my sister. I told her I loved her and that she was the best sister ever. I entered the OR, met the team, and climbed onto the OR table. The anesthesiologist grabbed my hand. Since I was awake for the entire surgery, she was basically hanging out in case something went wrong and they had to put me out suddenly. And then came the drilling. This sound was like brushing your teeth with a chainsaw. The whole procedure took several hours. I don't really remember how many, but I've been told about 8. Scary to the eye and longer than you think was that procedure. Recovery can take anywhere from 1 week to a year if something goes wrong in the OR. Typically, most patients are pain-free within 3 months. Though it should be noted that most of the pain and discomfort is more associated with the implanting of the battery in the chest and the wiring through the neck than the holes drilled into one's brain. Here, I'm only a few days after surgery. I felt a little better immediately after surgery, and my symptoms got better over time. When you're in hell for so long and you wake up without pain one day, you want to do everything all at once. It wasn't a manic compulsion. It felt like an uncoiled spring seeking all sorts of pleasures that I hadn't experienced in so long, namely freedom and autonomy. A few weeks after surgery, I ran a few miles to a local pizzeria a few miles away from my house. It wasn't the safest decision I've ever made, but the freedom and absence of my body pain and stiffness almost felt as good as the taste of that pizza. After recovery from the initial surgery, you still have to have your DBS system programmed. This is usually done with a neurologist. The neurologist connects the DBS wirelessly, often using an app on a tablet. They adjust the frequency, amplitude, and pulse width of the stimuli provided by the DBS until the patient has smooth motor control. This is an incredibly important step and can take hours over multiple sessions.
How effective can DBS be? Well, it depends on the individual. It's different for each person who goes through this procedure. Most people are relatively happy with the results, but not everyone is. On a typical day, I will now experience about 2 hours of mild tremor, some gait and postural instability issues, and my speech does get a bit worse throughout most days. However, I no longer experience any of the prolonged and severe bouts of dyskinesia I did before, nor do I have to deal with the crippling off episodes that I once had, where my motor function was severely impaired, and all this was thanks to my experiences of getting this deep brain stimulator implanted. Next, we'll watch some videos of what my motor fluctuations look like with my DBS on versus
these settings. Looks pretty good, doesn't it? I think so. And more importantly, I think it feels really good. So there doesn't seem to be any dyskinesia, and there doesn't seem to be any rigidity at all either. And there's also no tremor, from what I can tell. Maybe there might be a slight one, but whatever. Yeah, let's go for a little walk here.
In summary, DBS is a method for directly stimulating neuronal activity via implanted electrodes in the brain. It is invasive, but it can be life-altering. My relationship with my neurologist has given me my life back. There have been countless programming sessions since the initial surgery in which he knew exactly what I needed. There is no lifestyle choice or medication that I could have taken that has equaled the benefit that he has given me. In a nutshell, those sessions are the reasons for my independence. Thank you, Dr. Pisano. And if anybody wants to read more about the journey that I've been on December 15th, you'll be able to buy this book called Reprogramming My Brain, a guide to the future of the brain and neuromodulation, written by a patient and his doctor. Thank you all for listening to us. Sorry, Gina.
Thank you all for listening, and check out this book and ask us if you have any questions.
Bye, everyone.
Bye.